A very good evening to all of you. Today we are going to do pediatrics. Pediatrics has a very high weightage, about 15 questions in Neet PG. 10 to 12 to 15 questions are expected from pediatrics, especially the congenital heart disease part and the cardiovascular part. So let's begin with the first question. Which epileptic syndrome is associated with left hemispheric atrophy in a child? A. Dravet syndrome, B. West syndrome, C. Lennox-Gastaut syndrome, D. Dicey-Davidson-Mason syndrome. It is Dicey-Davidson-Mason syndrome. Hemiatrophy or hypoplasia of unilateral cerebral hemisphere resulting from CNS insult in fetal or early childhood period with compensatory ipsilateral calvarial hypertrophy. The insult could be vascular, congenital, or acquired ischemic disease, trauma, or inflation. A 5-year-old boy has recurrent infection, low platelet count, and a rash as shown below. What is the likely diagnosis? A. Severe combined immunodeficiency. B. Job syndrome. C. Bruton's agammaglobulinemia. D. Wiskott-Ulrich syndrome. It is Wiskott-Ulrich syndrome. There is eczematous rash, thrombocytopenia, immune deficiency, that is, recurrent infections, are the features of Wiskott-Ulrich syndrome. It is an X-linked recessive disorder due to mutation of WES gene mutation on chromosome XP11. Which of the following scoring is done to assess respiratory distress in neonate? A. Krebs score, B. Apgar score, C. Silverman-Anderson score, D. SNAP score. It is the Silverman-Anderson's score. Which of the following gene is implicated in pathogenesis of juvenile myoclonic epilepsy? A. FMR1, B. Fibrillin1, C. CHYNN1, GABRA1. It is GABRA1. Juvenile myoclonic epilepsy has been linked to mutation in many genes, including CACNB4, CLNC2, EJM2345679, GABRA1, GABRA-D, myoclonin-1, and EFHC1. Once again, CACNB4, CLNC2, EJM2345679, GABRA1, GABRA-D, myoclonin-1, and EFHC1. True about Fragile X syndrome is A. Triplet, triplet nucleotide CAG sequence mutation. B. 10% female carriers mentally retarded. C. Males have IQ 20 to 40. D. Gain of function mutation. It is. Let us look at the options one by one. In this, there is CGG repeats are seen in Fragile X syndrome, not triple nucleotide CAG sequence mutation. Mental impairment with retarded or borderline IQ in 35% of carriers. Which of the following disease these X-ray findings are seen? A. Gaucher's disease, B. Fabry's disease, C. Morquey disease, D. Niemann-Pick disease. Here you can see a peg-shaped intercarpus, rounded vertebral body with anterior beaking, peg-shaped metacarpus, and rounded vertebral body with anterior beaking. It is seen in Morquey's disease. Which of the following disease the skin rash shown in the picture is usually seen? Well, it is a Casals necklace. This Casals necklace is seen in pellagra, niacin deficiency, and heart nerve disorder. So the correct answer here is D, heart nerve disorder. So there is a skin lesions on the neck are shown. So it is a Casal necklace. Casal necklace is seen in pellagra, which is niacin deficiency. It is also seen in heart nerve disorder. So among the options, D is the correct answer, heart nerve disorder. An 8-day-old neonate presents with hypoglycemia, that is glucose is 17 milligram percent, And jaundice is diagnosed to have a metabolic disorder. Most likely diagnosis is A. Hypothyroidism, B. Galactosemia, C. Glycogen storage disease, D. Fatty acid oxidation defect. It is galactosemia. Hypoglycemia and jaundice in a neonate after initiation of breastfeeding suggest a diagnosis of galactosemia. So correct option is B. Please click the link in the description to join the ultimate 3-day Neet PG breakthrough blueprint. Go to the description, there you will find a link. In other videos also you will find the description in the link in the description. Just click that link and join that WhatsApp group. Stay in that WhatsApp group till you get selected, because a lot of activity is going to happen in these 40-50 days before the exam in this WhatsApp group. And please stay in the WhatsApp group. There will be no spamming or anything, no personal messages, nothing. Please don't. Um, uh, it will be your privacy will be taken care of. Don't worry about that. Identify the disease in child with violet color rashes around the eye and on face. A. Juvenile dermatomyositis. B. Systemic lupus erythematosus. C. Kawasaki disease. D. Schonlein purpura. If you are new to this channel, please subscribe it, because you will get the notification again and again whenever I go live, and I will be going live more often. Please also mention in the comment box which topics you find very difficult to revise, so that I can take a lecture on those topics and upload it on the channel. Please share this video with other your near and dear friends, so that they also will be benefited. Identify the disease in the child with violet colored rashes around the eye and on hands. Violet is a Kawasaki disease. Identify this device used in resuscitation. See, look at the disease. It is a defibrillator. Defibrillator. For children with pulseless ventricular tachycardia or ventricular fibrillation, emergency defibrillation is indicated. A 2-month-old baby with central cyanosis presented with John. Following findings: chest X-ray. What is the most probable diagnosis? A. Tetralogy of Fallot. B. Hypoplastic left heart syndrome. C. Coarctation of aorta. D. Epstein anemia. It is Epstein's anemia. ECG is showing tall Himalayan P waves, and chest X-ray shows box-shaped heart. It is seen in Epstein's anemia. The skin lesions shown in the picture are seen in which heart disease? A. Eisenmenger syndrome. B. Rheumatic heart disease. C. Infective endocarditis. D. Heart failure. It is rheumatic heart disease. The following X-ray finding is seen in which congenital heart disease? Well, you can see a snowman or figure of 8 appearance. It is seen in supracardiac TAPPC. Which congenital heart disease is associated with this child condition? Here you can see micronathia is there, erythronathia is there. It is seen in Peyronie syndrome, which is associated with ASD. Luton-Bacher syndrome comprises of A. Ventricular septal defect with aortic stenosis, ruptured sinus of valsalva aneurysm. C. Atrial septal defect with mitral stenosis, complete common atrioventricular canal. So this is a atrial septal defect with mitral stenosis. Luton-Bacher syndrome is defined as a combination of mitral stenosis and left to right shunt at the atrial level. The left to right shunt is atrial septal defect, ostium second hemorrhage. Which of the following condition can given figure be associated with? Here you can see a child with short stature, the dislocated hip, microcephaly, broad nasal base, epicanthal folds, micronathia. So the correct answer here is D. Fanconi's anemia. Following X-ray finding in skull can be a manifestation of, where here what you can see is a crew cut appearance is seen. It is seen in thalassemia. Hair on end appearance or crew cut appearance. It is seen in thalassemia. So correct option here is D. Thalassemia. Identify the nature of this finding. A. Renal cell carcinoma. B. Hydatid cyst. C. Polycystic kidney. D. Medullary sponge kidney. Well, it is a polycystic kidney. Again, this polycystic kidney is a very, very important topic in the pediatrics. Maximum urine osmolality in preterm neonate: A 200, B 400, C 500, D 800. It is 500. What is the most common complication of malaria in children? A. Cerebral malaria. B. Respiratory distress. C. Severe malarial anemia. D. Hypoglycemia. It is severe malarial anemia. It is the most common complication of children. Superior rib notching is seen in all osteogenesis imperfecta, neurofibromatosis, Marfan syndrome, coarctation aperta. Except coarctation aperta. Coarctation aperta causes inferior rib notching. And for the abnormal peripheral smear, A. Megaloblastic anemia, B. Thalassemia, sickle cell anemia, iron deficiency anemia. It is a sickle cell anemia. Poor prognostic indicator of ALL is A. Female sex, B. leukocyte count less than 50,000 per microliter, age greater than 1 year, hypoploidy. It is hypoploidy. Wish you all the best.